Nurse practitioner's job description and contract. Role description. A nurse practitioner, NP, in a primary care setting carries out the responsibilities of providing primary healthcare services to adults. The core responsibilities include direct patient assessment, diagnoses of illnesses, and treatment. NP's role also incorporates adherence to a plan of care, provision of a full range of primary care services, and participation in health promotion and prevention. NP is expected to engage in after-hours consultations and participate in the regular call schedule. Job description. Essential responsibilities. The scope of responsibilities includes patient evaluation, examination, and treatment, on-call emergency visits, diagnoses of illnesses, primary care services provision depending on the particularities of a patient, after-hour consultations, compliance with legislative regulations and corporate policies, health promotion and disease prevention work, teamwork participation. Minimum qualifications. Master's level of nursing practice. Valid advanced practice registered nurse license. Primary healthcare nurse practitioner certificate. Experience. Minimum of 3 years of experience working in a primary care unit in the position of NP. Contract. The current employment agreement is made as of June 21, 2019, by and between employer and nurse practitioner. Terms and termination. The initial term of this contract is 1 year and, if not terminated earlier, expires on June 20, 2020. This contract might be terminated upon the identification of the fact of the nurse practitioner's failure to carry out the responsibilities according to the official documentation. Compensation. Nurse practitioner's services will be compensated at a rate of $50 per hour. The salary will be paid according to the payment periods declared by employer. On-call visits will be compensated upon completion within a payment period and will be equal to $70 per visit. Continuing education. Within the organization's corporate programs of continuing education, nurse practitioner will attend professional training meetings, seminars, conferences, and professional conventions on a regular basis. It will also be required to participate in the development of preventive and promoting programs for the community. The employer is obliged to cover the expenses for traveling and accommodation if the nurse practitioner participates in national conferences. Malpractice. Employer provides malpractice insurance for nurse practitioner following laws and occurrence coverage policy. The employer is responsible for providing this insurance at their expense and doing so in a timely manner according to legal regulations. Billing and fees. This contract obligates the employer to bill all billable services nurse practitioner will provide within the scope of their responsibilities and duties. Nurse practitioner has no ownership interest in or personal claim to any fees charged or revenue received for any services rendered by nurse practitioner. Compliance regulation. This contract is reviewed and signed upon proper consultation with legal counsel. It states that the agreement is relevant to the local laws and regulatory policies and does not violate any laws of the federal or state legislature. Employer and nurse practitioner acknowledge the agreement to renegotiate the terms of the contract to eliminate any violations. Non-discrimination. Nurse practitioner and employer both agree to preserve a non-discrimination policy when carrying out this contract. They will not discriminate against others and will restrict any form of discrimination on the basis of race, ethnicity, gender, sexual orientation, age, or health conditions.